Hello, everyone. My name is David Keane with the IRFU, and you're very, very welcome to our latest of our webinars to do with the Tackle Law Trial. So we have a wide range of departments in the IRFU that are with us tonight to discuss different areas of it. We have the rugby department, which will be covering off playing and coaching. We have the competitions department, the refereeing department, and the medical department as well. So we have some excellent speakers tonight. So first up will be the Director of Rugby Development, Colin Madd, who will open the webinar. Then we'll have Colin Finigan, who is a National Rugby Development Manager and Project Lead. He will be talking about the overview of the process. Then we're very lucky to have Duane Phillips, who will be from the referees, head of referees, who will be talking about decision-making framework. We have competitions manager Kevin Beggs, who will be going through some videos on different types of tackles. And last but by no means least, we'll have Dr. Rob McLaughlin, who is the IRFU Medical Director, who will be giving a medical update. So just to let you know that this webinar will be recorded, and we will be sending this all out to the clubs. And if you have any questions, there is a Q&A section in this webinar which you can use, and we'll endeavor to try and answer the most frequently asked questions. If we don't get to answer your questions, we will look to try and address that and get the answers out to you as well. So it gives me great pleasure to bring in Colin Madd. Colin, how are you?
Yeah, good evening, Dave. Yeah, good. Thank you. You can hear me, yeah?
Yeah, great to have you.
Yeah. Yeah. Good evening, everyone, and you're very welcome for this this webinar. Just a few points just to lead into the webinar itself. One is just to thank everyone for giving up their time this evening, and as David alluded to, we just feel it's important with 2 months in just to do a check-in to see where we are in the trial. Just to recap slightly on the trial. The whole principle of the trial was born out of a lot of research in relation to how can we make our game safer, and really looking at player welfare as a key driver in that. And even from a practical side, how do we ensure that we have 30 players enjoying the game, but also 30 players leaving the game in a good nick after the 80 minutes. So we embarked on the law trial, and I suppose we have some trends that are coming out of the law trial, which are quite similar to other nations or other unions as well, that we do find, in initial stages of, any sort of change in law or trials of this nature, that it does take a while for people to adapt, to adjust, and that's the behaviors of our players, of our coaches, and our game. And we just want to really bring you guys to where we are today, and to maybe provide some insights in relation to what we see. But fundamentally, we're on a journey. We're not going to change things in 2 months, but I do believe within the space of a year or two that we'll all get to a destination that we're quite proud of our game, and we're quite proud of the changes we've made to make the game safer and to make it safer for our players as well. So I'll pass back over to you, David, and or to Colin, I think is on next, Colin Finigan. And we'll touch base later on in the webinar. So Colin.
Great stuff. Thanks a million. I'm going to bring in Colin Finigan now, National Rugby Development Manager and expert on this, as he was being the project lead. So I'm going to pass you on to Colin. Colin, how are you?
Not too bad, Dave. Can you hear me okay?
Yep, absolutely.
How are we, folks? I've just gone full cliche. I'm actually doing this in a dressing room of a rugby club, just to really connect. But look, this is the reality of the game. I know everyone has places to be and take different things they need to do as they go forward this evening. So we'll try and be short, sharp, and make sure we have as much information for you as possible. Look, first things first, I want to say a massive thank you. Change can be hard, and everyone has bought into it. There's been a massive buy-in after people completely understanding that this is an area that we need to address and we need to look at. People have engaged in the consultations, and look, again, the numbers that are engaged in this webinar is an example of that constant process of education and learning that we're all going through, us as staff, as well as you on the pitch and around the pitch as well. Overall, the process has been ongoing since January. So if we look at it, that's on the face of it when we started investigating the need to go into a law trial possibly and to go and start engaging with stakeholders. But the IRIS project has been going and surveilling data for many years now across a number of our different areas of the game. So this is something that Irish Rugby has had a keen interest in, and our medical department will speak later on to some of the new innovations that are coming, and they are certainly at the forefront of everything we do and at the forefront of a lot of the positive changes that happen in World Rugby as well. We always said that the implementation phase was going to be the critical time for the trial. And after the initial stages of that, it's important that we redouble our efforts to improve that tackle behaviour. There's been massive, I suppose, as I say, buy-in across everything that we've done, but we can't stop now. We need to keep going. So what does this mean? It means everyone has a role, whether you're a player, a coach, match official, or support staff member, a member of a club. Everyone has a role within this, and that role is to go and upskill yourself, educate yourself, and to go and cooperate and coordinate and align with everyone. We're all working together on this for the safety of our players. This webinar is part of that process. We need alignment and cooperation moving forward. And look, Kevin will come to some clips later on, what is foul play, what isn't foul play. And we will be using, I suppose, our socials and our direct emails to all the clubs over the coming weeks to seed out all those clips. Again, wanting to be aligned to make sure that everyone understands at every point in this process. Match officials, players, coaches are all human and have to make split-second judgments on what they see in that moment. So we need to make it as clear as possible. Okay, paint good pictures, and you'll hear the word good picture maybe a couple more times tonight. Paint good pictures. If you leave yourself or make it a legal tackle, you open yourself to the possibility of further sanctions. The old boxing analogy says, don't leave it in the hands of the judges. Make sure you have a good picture and make sure that the referee can see that. We don't know the outcome of this trial. Nothing is predetermined in it. We have signed up for 2 years, and it's important that we work together. So over the course of that time, we have a genuine result that can inform the next steps. Nothing is fait accompli about anything we're doing here. We are going to go and make decisions that are best for our stakeholders in Irish rugby. One thing is certain, to do nothing was never an option, and we need to find a solution to ensure our players' welfare. For now, we're targeting that change in behaviour in our tackling. I'll finish off just with some reasons for optimism, okay? If you look at what New Zealand Rugby and France, who have actually come out and been some of the foremost proponents of this, who have started the trials earlier. New Zealand Rugby have now extended their trial to make sure that they are now in line with World Rugby. They're seeing massive positive trends so far, including increased player safety and, through sentiment surveys, increased player enjoyment. They've seen an upsurge of 7% of new participants in the game as well. So there are a lot of positives coming out in other countries. Again, we're very early in our process, but stay with us. All right. This is about making the game. It's about player welfare, and it's about making the game safer for absolutely everyone. Dave, I'll hand back to yourself.
That's great. Thanks a million, Colin. That's great to hear all the good news as well, and from New Zealand. So our next speaker is Duane Phillips, head of referees. Dudley, you're very welcome. And maybe you could give us some insight into the decision-making framework.
Yep. Thanks, David, and good evening, everyone. As David just alluded to, I'm going to take this opportunity maybe to revisit and explain to you the messaging that we've been giving our referees since the start of this season and indeed the start of the trial. So, as Colin just rightly referenced, referees get to make these decisions in a split second, one time, at full speed. So what we've tried to do is give a referee a framework to follow to help achieve the best outcome as possible. So when presented with a tackle situation, the referees will judge the point of contact by the tackler. In a situation where the referee feels that there might have been contact above the line of sternum, but it's not clear and obvious, referees are going to be encouraged to play on, but are asked not to ignore it. At the next opportunity, be it on the way to a breakdown or most likely at a downtime, they should speak with that particular tackler and remind them about the height. If that is a trend, the referees will be encouraged to speak with the captains and try and get their buy-in to work with the players also. In an incident of clear and obvious foul play, a referee will enter into the decision-making framework. Once it's been established that the foul play has taken place, the referee will then consider the facts. And again, let's remember, he or she gets one look at this in full speed. So, level of danger, it could be a low danger, which could be indirect, low force or low speed. There could be medium danger, which could be of a higher force or speed, or of a high danger, which could be no control, high speed, and dangerous. In such cases, mitigation can play a part, and such as a drop in height or direction of the ball carrier if it's significant and sudden. But this mitigation can only be applied if the attempted tackle was legal, i.e., if the tackler has attempted to bend and wrap with both arms, etc. If the tackle was illegal, there's no opportunity for mitigation. A point worth noting to you is that a significant number of sanctions this season would have been foul play before this trial came into place. So this time last year, we would have seen the same incidents of foul play being sanctioned. In addition, this season, we have also seen an increase in the number of double yellow cards which have been issued. And these can be as a result of escalation due to a team repeated infringements or indeed standalone acts of foul play. The second yellow card has then been issued due to the referee not seeing a change in player behaviour, with the players not presenting the referees with a better picture of the tackle. So if I was to leave one message, particularly in that, would be players can help the referees by showing the picture, the bend, the wrap, and dropping the height. So I hope that gives a little bit of clarity and insight into the refereeing decision-making process. Thank you. Dave, I'll hand back to you.
Thanks a million, Dudley. That's fantastic. So just a reminder to everyone as well, if you have any questions for our panel, just use the Q&A section at the top of your screens. So please feel free to type in the questions into there. Delighted to have Rugby Competitions Manager Kevin Beggs with us as well. Kevin, you're very welcome.
Thanks, Dave. Just a reminder that there is a chat box on this. If anyone does have any questions, Dave can hopefully spot them and we can bring them to the meeting. Yes, I'm the competitions manager. I also act as the disciplinary officer for the IRFU. And I think it's important to note that a lot of the times we see the professional game, which is a completely different game when it comes to this. They have multiple camera angles, and they are not adopting a lower tackle trial as we are in the domestic game. There's a few points I want to make. The sternum tackle is classed as foul play. Okay, so it's not a technical incident. It's classed as foul play. We can get technical penalties and we can get foul play penalties. If a player has committed 2 technical offences and receives 2 technical yellow cards, then normally sending off is sufficient. If a player receives 2 foul play yellow cards, then the default position is a 1-week ban. So that's important to notice the difference, that it is a sternum tackle is indeed a foul play offence. As Dudley alluded to, repeated high tackles may see a player receiving a yellow card because of the team offences. In other words, there's been multiple high tackles before his one or hers, and as a result of that tackle, the player may receive a yellow card. So that's important to note. We've got a few clips that we just wanted to show. There are 4 clips in total. The first 3 are foul play clips. Okay, so we're going to roll through them just to give you an example. And remember what Dudley said earlier about painting a picture for the referee, that the referee will see these once in real time and has to make a decision based on what he's seen in real time.
Okay, Kevin, I'm just going to roll this here. Can you see my screen, Kevin?
I can, yep. I can, thanks.
Okay. So here's the first clip.
We'll just play this first clip. It might be a little bit jumpy, but what we see is the defender, the referee very quickly, who's very close to the action, very quickly sees and identifies that the tackle is too high and blows a penalty. We can see from that still that the tackle is clearly around the sternum area. The left arm is raised up. The player, the blue player, hasn't bent at the hips sufficiently to lower his body height, and as a result, he's committed an act of foul play. Okay, the next one, please, Dave. So what we're looking at the bottom of the screen, we can see that the green and red players come off the back of the line out. Maybe just go back one frame or 2 frames there, Dave, if we can. And one more. So we've got, in this position, we've got the tackler who's running directly at the ball carrier. There's no attempt to lower his body height. He's upright. The heads are in the same space. The referee is right behind looking at it very closely, but had he been on the other side, he would have been asked to make a very rapid decision on what happened here. The tackler is upright, both hands. You can see just that the arms are above the shoulders. Again, clear foul play. Go on to the next one. Thanks, Dave. Okay, in this clip, the tackler comes off worse. He was removed from the game. So just try and see that again. The ball carrier runs in. Here we go. Heads in the same area. The defender is upright. There's shoulder to head contact. Tackler hasn't lowered his body height, hasn't attempted to tackle around the belly. And as a result, again, clear foul play. And you can see the position of the referee, who has got a bird's eye view. He's only a couple of meters away. Even when you're really close and you see it like this in real time, it's still painting a picture for the referee so he can make a decision.
So Kevin, our next clip is going to be, so what we would classify as good. So maybe you would talk us through this one.
Yep. So here we have the tackler in red. I think it's red 6. Tackling around the waist, going to ground with the ball carrier, clearly lowering her body height, tackling around the waist, heads in a different space, excellent technique, and as a result, there we have the perfect tackle there, and there's no foul play. So the first 3 are all foul play penalties. This is an example of what good actually looks like. So again, player welfare, trying to change player behaviour to end up with tackles, as we saw in this last one.
Super. That's really good. Thanks a million, Kevin, for going through those clips with us. Now we're going to delight to bring in the IRFU Medical Director, Rod McLaughlin. Rod, are you there?
Yeah, I am.
Super. Lovely to have you, Rod. And maybe you can give us the medical update. And you let me know when you want to share your presentation, and I will do that.
I think if you share it, and I'll talk while you're drawing it up. I suppose just to say to people, we're in a trial, and people need to understand, therefore, that we are monitoring what's happening. We're asking for a change of behaviour, monitoring what's happening. So just to give people insight of how we're going to monitor this. So, as has been mentioned, we have our Irish Injury Surveillance Irish study, which has been going since 2016. So we'll compare injury rates of what was happening before the trial with what has happened during the trial. The second thing is we will be analysing game videos. So analysing videos of games before the trial with after the trial, looking at any impact on the game in terms of passing, passing rates, ruck, small scrums, and things like that. And then the third part of this will be surveys of stakeholders. So asking coaches, asking players and referees and stakeholders what they feel has been the impact of this trial. So I think it's important that this is broader than just concussion, because what we're trying to affect here is head impacts, not just concussion. And as everyone has said, player welfare drives this. We're looking for a behavior change, and it's to drive safety. So if you give me the first slide there. So what I'm going to try to do today is very high level, 3 or 4, I think it's 5 slides or something, is just some incredibly high level reminders, and then just focus a little bit on what we're doing that is to try and help you. So just to remind everyone, the domestic game is a recognize and remove. If you suspect somebody has a concussion, they are removed. There is no head injury assessment in the domestic game. And I say that because we still get people say, I'm just taking them off for an assessment to make a decision. It doesn't exist in the domestic game. We do not have the capacity, the facilities, the resources. The clubs don't have it. We don't have it to deliver a HIA system. If you go to the next slide, please, Keener. I think it's also important that remember that the referees undergo training in concussion recognition and are fulfilling one of their basic functions in terms of player welfare and safety in any game. And the whole management of concussion falls under Law 3. And under this, they have the right to remove any player for any reason of player welfare. And clearly the other thing here is no player can return to field of play that day. Simple as that. You're off and you stay off. If you move on, Keener, in terms of, we are updating all our resources, and you'll see some of these go on the website in the next week. And so what has happened is there has been a new consensus statement, and we are updating our resources based on that. And I think the takeaway here is in the area of concussion, on our website, we will have a specific document, a longer document, fuller document you see there on the left for the general public. We will have a much more operational and medically based one for healthcare practitioners. And then on the right, you'll see a new updated concussion wallet card. So the concussion wallet cards will be going to print very soon, and we'll get those out to you as soon as we can. If you go to the next slide, Keenan, I think in terms of the area of probably some of the biggest change that's come out of Amsterdam, the latest meeting, is this whole area of return to play. So again, you see, we're going to have the same 3 documents, a graduated return to play protocol document, a new one for the general public there on the left, and on the right, one for healthcare professionals, much more in-depth, and then wallet cards. So if you go to the next slide, please, Keener. I suppose one of the things that we've gotten in feedback is that players are frustrated that the management of concussion has been a very passive thing. In other words, it's been gone off and rest for a week or 2 and then come back to us and we get you ready for a game. So high level, what I want you to take out of this is we are now accepting that there are different types of concussion. Concussion can affect people in different ways. And depending on the type of concussion, be it one that mainly affects balance, be it one that affects cognition, the management may differ slightly. But the other thing is 70% of concussions happen in the tackle. And there you see in black. So as part of this graduated return to play, we're introducing this idea of relearning the contact skills. Because if you go back with the same poor technique or balance problems that interfere with your technique, the likelihood is you will get another concussion quite quickly. So again, just so people see that, and if you go to the next slide, Keener. So, and these are as appendices. So this sort of thing is as an appendices in the longer document. But what we're trying to do is make the medicine more appropriate to the final outcome, to player performance and enjoyment. So what we're trying to do is add things to the greater return to play that make your player perform better and less likely to get a recurrence, and therefore you have them more available to you. Now that's a very quick fly through it. I'm happy to take questions on any other things people may have, but just say that. Thanks for that.
That's brilliant, Rob. Thanks a million for that. You're very good. So you've been given the chance to ask some questions, and we're just going to ask a few. The first one actually is going to bring back in Duane Phillips. Dudley, are you there with us? So the question here that we have from Brenda is, has there been any chance to contact through a ruck, i.e. counter ruck, called a number of times and signalled as a high tackle during a recent AIL game?
No, no, there's been no change to this area of the game due to the trial at all. Players have always been, and I suppose always will be, liable to sanction if their entry to the ruck is considered dangerous. So without looking at any specific incidents that's been referenced, there's no change to the law. If a player enters the ruck dangerously, in the opinion of the referee, they are liable for a sanction.
Lovely, thanks a million. We have the next question here is for Colin Mack. Maybe Colin McAdee, bring you in. The question is from Connor, is why is the tackle height law changed for the community game and not the professional game? Kids we coach watch the professional players and typically follow what the professional players, often their heroes, do on the pitch. What makes it more difficult to coach a different tackle law? Would it be better to ensure that the same laws are applied at every level?
It's a great question, and it's one that we probably won't be talking about it in a while, Dave, because I suppose firstly to go back to the tackle itself, in players learning how to tackle, nowhere in any union does it suggest that you learn how to tackle above the line of the sternum. It doesn't appear in any key factors right across all unions. So every player, no matter if they're professional or amateur, they've all learned how to tackle in a low, safe manner. I think the other thing was timing. The timing when this law came in from World Rugby for unions to opt in was leading into a World Cup, and at that stage, I don't think the professional game were going to change or flirt with any law changes leading into a World Cup. Secondly, the games are quite different in relation to the professional game and the amateur game, where professional rugby players are training up to 8 times a week, or even more. They're also, when we look at matches as well, they as someone alluded to earlier on, there's 4 or 5 camera angles. There's a HIA protocol. There's full 24-hour management and care of all professional players before, during, and after games, and you also have a TMO. But the one thing to note, if you look at the professional game, all high contact areas are absolutely being sanctioned. And we're not about trying to have 2 different games. This is it's really important here. The most important message is we have a duty of care to our players, and we need to make sure that our game is safe, and the environment that we expose our players to is safe and relatively safe in a contact sport. And what we're doing in this trial is, because all the science and the evidence has suggested that by reducing the tackle height, we will reduce more head-on-head or shoulder-on-head incidents, which is only better for the game and only better for the players. So yeah, there is a slight difference, which I do think it will correct itself in time. And moreover than that, David, within the community game and the amateur game, we have probably 98%, 99% of participants, and they're all levels of ability, and they're not all training 8 times a week. So I do think there is nuances there, and for us and for the community game, it's probably the first time the community game has taken a step forward, because in the past a lot of law changes have gone into the professional game before the community game. But I do think it'll level out in time, David, and more importantly, it's done for the right reasons. And I'm quite happy that we're into this trial, to be honest.
Yeah, I always remember as a referee, the very first referee course that I did, safety of the players was the most important thing. And it was the very first thing that we learned. And it is hugely important. So thanks a million for that. And we now have a question. I'm going to bring Kevin in. Kevin, we have a question in. Kevin mentioned that normally if a player is awarded 2 yellow cards for tackle offences, that the sending off is sufficient. And whereas 2 yellow cards are for foul play, that 1 week suspension applies. Is there a suspension where there is a mix of both, i.e. 1 technical yellow and 1 foul play yellow? So Kevin, maybe I'll bring you in on that one.
Thanks, Dave. Yes, if the 2 yellow cards are a combination of 1 foul play and 1 technical, then that generally is sending off sufficient as well. It's only when there are 2 clear foul play yellow cards that the default position will be a 1 week suspension. In law, it's 2 weeks for the act of foul play, the lowest form of sanction there is. The player accepts this, 50% mitigation will get him or her a 1 week suspension.
Super, Kevin. Thanks a million. Colin Finigan, I have a question for you. Does lowering the tackle height not put the defender in a more dangerous position, stray, knee, elbow, etc.?
Thanks, David. Look, again, in contact sport, there's no way to absolutely eliminate risk, but we are trying to mitigate it and reduce risk. And that's the key part of this. Yes, absolutely. There's always dangers when completing a tackle in a contact sport. And you'll see a lot of the literature and things that we speak about on our website, which is the tackle behaviours area of irishrugby.ie. It often refers to the tummy tackle. So it's that idea of making sure we're aiming for those soft parts to try and avoid those elbows, knees, and more hardened parts of it. Again, it's something that we'll be looking at and monitoring closely through all our studies within this. But it's certainly important that we make sure that we think about the most dangerous area first, which is that head-on-head contact.
Keena, can I maybe come in there, Keena?
Yeah, absolutely, Rod. Yeah.
So to maybe answer that question with some evidence from the professional game. So as Colin says, this is about risk reduction. And what has clearly been shown is head contacts where it's head on head have the highest risk of causing a concussion. And we have this safe area, the belly area, you know, between the waist and the torso. So, but below that is an orange area. So absolutely there is a risk that, you know, with lower tackles that you can hit the hip or the knee. But what the evidence shows is that the risk of having a significant head impact is lower than if people stay high. So we're shifting the play to the green area. And yes, people will tackle, but they'll be moving to the orange area rather than the red area. And as Colin has mentioned, the actual figures are given in the medical document on the website. So, you know, and that's been looked at. What is your risk of needing in the professional game a head injury assessment when you tackle at the various levels? And what's clearly shown is, yes, the knee and the elbow are risks because they are hard areas, but the head's a much higher risk. And we're trying to get into the lower risk and the least risk areas, just to say that.
Lovely. Thanks a million, Rod. Now, we've got lots of questions coming in, and what we're going to do is we are going to update our frequently asked questions section on our website. So keep sending them in. It's fantastic that we get those questions in. I'm going to finish with a question for Colin Madd, if I could. And it's from Johnny Murphy. With players who are contracted and being coached one way, day in, day out, is it fair to ask them to do something completely different on Saturday when released to their respective clubs? So maybe I'll ask that one to you, Colin.
Yeah. Firstly, yeah, we're acutely aware with development players and academy players that when they're playing in the professional competitions, they're not applying or they're not playing to the same law trial as we are. But we have to look at the overarching principles of what's right for the game and the community game, where 99% of the players play. But fundamentally, right, a good tackle behaviour, what we're asking for is 4 inches of a difference. We're not asking for a whole lot. And be you an amateur player or be you a professional player, good tackle technique with really good accurate entry points really mitigates you as a player from being either giving away a penalty or being sanctioned, and also maybe having an impact on your team then if you weren't doing that. So we've all watched professional games, and one that comes to mind is Ireland beat South Africa, and I don't think there was one high tackle or high sanction. So we see our pro players making really good, accurate, good entry points, good tackle behavior, and exhibiting really good technique and being really effective in that. And I think that's what we're doing. We're speaking with the high performance. They're aware of this, but they don't see the challenges maybe that we're foreseeing, and they think their players are well capable of adapting.
Brilliant. Okay, thanks a million. Before we finish up, Rod, you wanted to come in.
Yeah, I noticed in the chat there's a comment about players lying. limited numbers of players available and the feeling that the likelihood that players will lie around concussion is therefore increased. I think the important thing for me is people need to understand, and particularly players, why we're doing this. I'm not doing it for me. I'm not doing it for the IRFU. We're doing it for players' own safety and their own health and their own welfare. And if they're lying, we need to work harder at them understanding what we're trying to do for them and what they should be doing for themselves. And if you want to look at a pure performance approach to this, players who are concussed are the players most likely to miss the next tackle, to underperform. So at both a performance level, it doesn't make sense. And we've shown videos of players being concussed and then subsequently tries let in. And at the high performance level, that's what they're interested in. And I understand the idea of teams and limited numbers. But the more important thing is that you have players that are able to play and are enjoying the game. The second thing is there was a recent study out of America in the last year or so that showed that for every 5 minutes you stay on, you add 3 days to your recovery. So actually, these players are getting whammied in numerous ways. They are not performing, they are putting their health at risk, and they're actually increasing the length of time that they will be out before they'll play again. So if they think they're doing their teammates a favour, I would suggest they're failing on all levels. But that's the thing we need to get across. That's where we need to drive it, so that people are clearly making decisions for the right reasons. Thanks, Keener.
Thanks very much. Okay, that sort of brings us to the end of our webinar. We really hope you enjoyed it. As we said earlier on, we will be sending out a recording of this webinar to all clubs, and we will be updating the frequently asked questions on our website as well. So